Thank you, Dhanvantri, for giving me this opportunity. Myself, Dr. Bhavisha Chauhan, working as an assistant professor in Department of Panchakarma at Sri Swaminarayan Ayurvedic College, Kalur, Gujarat. Today I am going to talk about introduction of Panchakarma and its future perspective. Panchakarma is a 5 elementary therapeutic procedure. Include Vaman Karma, Virechan Karma, Vasti Karma, Nashya Karma and Rakta Moksha. These procedures are called as Shodhan Chikitsa, which do radical expulsion of toxins and vitiated doshas accumulated in the body due to intake of improper diet, not follow the daily and seasonal regimen, and to maintain the equilibrium of three doshas. As the aim of Ayurveda is maintain the swastha. Swasthya swasthya rakshanam, atur vikar prashamanam. Moreover, to this Panchkarma, which is Shodhan Chikitsa, have various benefits than Shaman Chikitsa, which are Snehan Swedan. The procedure are aimed to detach and mobilize the doshas. Snehan together with Swedan increase the cellular permeability. Snehan can easily access to every level and can bind with the substance those are to be eliminated. Because of increased permeability, this becomes easier. Being detached from their abnormal location, they move towards their sthan, having affinity with them. When the doshas reach to their sthan in the coast, they are eliminating forcibly through the nearest and the convenient route. Then after comes Vaman Karma. Vaman Karma is medically induced emesis where expulsion of morbid doshas via the upper passage of GI tract, which means oral route. In Ayurveda, Acharya has indicated Vaman Karma specially to eradicate Vaman and imbalanced cough dosh from the body. In routine practice, I have treated many patients suffering from skin disease, obesity, and acidity, and have observed relief in their condition. So, Vaman Karma is not only a locally stomach lavas but a systemic cleansing for cough related substance. The example of drainage of water from the overfilled rice field given in Ayurveda text helps in understanding this very easily and well. Certain amount of water is necessary to remain in the rice field for the proper growth. If it is less or dry, the crop will dry. On the other hand, if water is excess, then also the rice plant dies. Cough in human body represents water. A normal amount of cough is necessary for the survival. Its excess and diminution both are harmful for the body. The drain out excess of water from all the concord reach to the opening and drain out. Similarly, in Bowman procedure, whole excess of cough related substance from all vicinities of the body brought to the upper part of gastrointestinal and expelled out. This woman remove the substance those are responsible for enhancing heaviness, oiliness, viscosity, sweetness in the body's atmosphere. Then after comes Virechan Karma. The term Virechan is purgation therapy to expel the vitiated fluid which is expelled comfortably via the lower passage of the gastrointestinal tract, which means anal route. This virechan is not only local cleaning of the small intestine but systemic cleansing for pith-related deformities. As pith dosh is main line of treatment for metabolic disorder, and there is a direct relation of pith and rakta. So disease related to rakta dusti can be treated with virechan karma like acidity, skin disease, and paralysis. The example of pacifying the heat in a house, pacifying the fire in a fireplace given in Ayurveda text help in understanding very well and easily. Fireplace is used in the houses in cold countries to keep houses desirable warm. Heat is to be maintained in the fireplace. If fireplace is high, it will make the house also uncomfortably hot. One has to pacify the fire to reduce the heat in the house. The fireplace for pitta or agni in human body is umbilical region and the region of small intestine. Like the fire in a fireplace, agni seated here radiates the energy to energy throughout the body. To pacify increased pitta, it is to be controlled in this region which is its site. When we use word expulsion, this means the expulsion of the substance which are responsible for increasing acidity, heat, and liquidity in the body's atmosphere. Then after come Basti Karma. Basti Chikitsa is a medicated enema which is an excellent method to expel all three doshas, especially Vat dosha. According to Acharya, the half of the disease are caused by Vat dosh. And so Basti Chikitsa is also called Ardha Chikitsa. Basti are not meant for only cleansing of the colon, but they are designed to expel the harmful substance from the adjacent region to the colon. Sometimes they are aimed to promote anti-Vat properties in the atmosphere. As explained earlier, colon is considered as the seat of Vat. In elimination type of Basti, the substance those are related to Vat and concentrated in the atmosphere around the colon are expelled easily. On the other hand, in nutrition type of Basti, substance having anti-Vat action act on the possible receptor present in the colon. For the brain overwhelmed by modern conventional science, it is worth mentioning that now science consider the existence of enteric nervous system consists some 500 million neurons, 5 times as many as the 100 neurons in the human spinal cord. Major neurotransmitters like serotonin, dopamine, glutamine, norepinephrine, and nitric oxide are in the gut. Also, several neuropeptides are there along with the major cells of the immune system. Epinephrine are also in gut. When we think about mode of action, we have not to think only the basis of colonic absorption, but we have to consider more the possibility of action and colonic receptors. Then after come Nasya Karma. Nasya Chikitsa means installation of medication into nostrils. Nasahi Sirsodwaram means a nasal route. Nasal route is the direct entrance for the head. Nasya is the main line of treatment for Udva Jatrugat Vikar, which is the disease above the shoulder. Disease like rhinitis, migraine, or any kind of headache, hair fall, frozen shoulder, cerebral palsy, etc. Nasya is advised to prevent penetration of coronavirus through nasal cavity. Panchakarma for healthy people. In daily lifestyle, we have advised for Nasya, Snehan, Basti, and Karnapuran, etc. In Vasant Rutu, there are March and April, Kapha dosha predominance. There are advice for Vaman and Nasya. In Varsha Rutu, month of July, August, and August, September, Vat, those predominance are there. So Basti is advised. In Sharad Rutu, September, October, and November, Pitta dosha are predominance. So Virechan and Rakta Mokshan are advised. Panchkarma is geriatric and pediatrician. Panchkarma can also be done safely in any group. For example of Basti treatment can be given to very old person and also a newborn baby. It is equally beneficial for men and women and all type of Panchakarma can be done in adults. It is especially practiced in increased immunity and sexual power before starting Rasayana or Vajikaran treatment. It is always advised to undergo through the detoxification process called as Panchakarma. Panchakarma is used for all type of chronic disease as well as for newer disease in disease like asthma, diabetes, high blood pressure. This treatment is given a very enthusiastic positive result. In acute pain, swelling, procedure like Snehan and Swetan and drug motion help in to relieve symptoms very quickly. Panchkarma is also advised before and any kind of surgical treatment that the recurrence of disease can be checked. It is also help to reduce the total time taken for the treatment of chronic disease. Excess toxins and eliminated by this process, thus giving medicine more space to act fast. Panchkarma is a cost-effective treatment since time taken to cure a disease is shortened. Total cost of treatment goes down. Thank you so much for giving me this opportunity. Thank you, Youth of Ayurveda. Thank you, Dr. Hemantri.